Hey everyone, Justin Jolene here. I wanted to share this really cool guide with you on return to run guidelines after ACL reconstruction. And before we dive in, let me just give you a little outline of how we'll use this guide. So we'll start with just a quick review about ACL reconstructions, and then we'll get into some of the return to run criteria, both subjective and objective tests. Talk about gait deviations and how those gait deviations relate to post ACL reconstruction and also what you'd want to watch for, because that leads into our next conversation about running gait retraining and strengthening. So let's get into this evidence-based guide. Now let's start with what ACL reconstructions are. And most of you know what these are. There's many different graphs, many different types of ACL reconstructions. But what I want to talk about in particular is that athletes can return to running after 3 to 4 months. But it's best to really be on that 4-month mark because it's going to allow for adequate revascularization of the graft. And of course, these patients should have full range of motion, no swelling, non-antalgic gait. That should be a given before anyone starting a ACL reconstruction return to run program. Now, in here, we really want to make sure we're allowing for that 12 weeks post-op. However, I will say they're allowed to run after 12 weeks. I like to see them running after 4 months. So again, that's up to the clinician's discretion. So let's talk about the return to run criteria. This is one of the really important things we need to be mindful of is what is the return to run criteria and how are we evaluating these patients to get back to running. Now there's subjective tests and objective tests, and the subjective test they find is most helpful is the International Knee Documentation Committee subjective form. And on that form, we want to see a score of over 64. And there's also several objective tests as well. You've probably heard me talk about this before, but one of the essential things to use is the Limb Symmetry Index, or LSI. Now, the LSI is going to compare the bilateral legs and compare how much strength each of them has. We want that strength to be generally on our scores over 90%. So you take a functional test like the single leg hop, you measure that distance, and then you're going to calculate it in the LSI to be able to get your number. Now, with isometric testing of the quadriceps, for example, we want to have a dynamometer score of over 80%. And there is some research that came out recently that even shows that a lot of these hop tests and a lot of these criteria for testing are actually overestimating the strength of the quadriceps. So that's why when we single the measurement out on a dynamometer, we can see that over 80% is great, but we want to see at least that 80% mark on the LSI. The hop test or the hop cluster is a little different. The single leg hop, triple hop, crossover hop, and 6-meter timed hop. We want to see all of those are over 90%. Moving on to some of the running gait deviations that we have, we see patients presenting with several compensations after an ACL reconstruction, and some of those deviations are going to be related to the quadriceps. One of them in particular can be the quadriceps avoidance gait pattern, which would basically be a quadriceps weakness. And that's going to be an increased knee extension at initial contact, and that's going to be decreased knee flexion during weight bearing and especially during mid stance. So we don't see that they're sinking into their gait as much and that they're overcompensating by trying to extend their knee too much at the start of the gait pattern. That's essentially going to make it so the quadriceps don't have to work as much. Another common gait deviation is going to be tibial external rotation, and this is especially in your hamstring graft patients because they're going to see that hamstring is just not as strong on the medial side, which is causing some external rotation of the tibia. Now, what do we do about some of these running gait deviations and how do we help patients overcome these issues? So the running gait deviations can be addressed with some gait retraining and strengthening. And it's really important because you want gait retraining and strengthening to go together. Now, for strengthening, we want to really focus on resistance that is going to be what's going to help the most. Heavy resistance training. Plyometrics are really good, and we see a lot of people really benefit from plyometrics. However, resistance training, especially heavy resistance training, is really, really good. Single leg squats weighted, single leg press weighted, single leg wall sits weighted are all really good. And then the gait retraining. Relax your knee when your foot hits the ground. You can tell that to your patient, or you can say sink into your stride when you're taking a step. You can also use techniques like mirrored feedback, where you're having them run with a mirror and identifying for the patient to identify where their running gait deviations are occurring or where those gait patterns are differing. And you can also do things like digital feedback using wearable tech or force plates, 3D imagery to be able to really highlight to the patient where some of these deviations are occurring. Please feel free to take this ACL guidelines on return to run and use it as a reference. And you can also see all the research articles here that are things I've referenced to make up this guide. This can be a really handy dandy way just to be able to remind yourself how to make some of these return to run decisions. And please feel free to check out our return to run phases, or the guidelines in terms of return to run, with intensity, frequency, duration, how much the patient should run at each phase, to be able to understand, once you get that ACL patient running, how do you actually progress the return to run program. But again, this can be a really good way to be able to address these ACL patients. Make sure that you're using evidence to return them to running and to keep them safe. Until next time, please let me know if you have any questions or want to talk about this, and I look forward to seeing you soon.